My blood pressure was sky high, my cholesterol numbers were out the roof. I was watching old commercials, the Weight Loss Institute, and decided, well, I've watched it too many times, it's time to go to one of these seminars. These seminars are free that they offer, and it's a great place to start. They've got a great staff to work with, they'll answer all your questions. Do something now, do it for yourself.
Call Weight Loss Institute of Arizona to register for a free seminar. 855-PHX-THIN. Weight Loss Institute of Arizona, your lap band expert.
You know, losing weight is tough, but when your scale really feels out of control, most people don't know what to do. Banner Estrella Medical Center can help. And now Dr. John Tabaros, the co-founder of the Weight Loss Institute of Arizona, is with us today, and he's going to share with us more ways to lose weight. Thanks for coming on the show today.
Thank you for inviting me.
I appreciate it. Let's talk about, first of all, the true cost of being overweight.
Well, that's a very simple answer to that. The true costs of being overweight are multifactorial. Most people are on multiple medications for all different types of medical issues like hypertension, high cholesterol. And a lot of patients, the majority of them, studies show that about 96% of patients with a BMI over 35 have some form of sleep apnea, which is an independent risk factor that leads to high blood pressure. There are other associated things with being overweight, diabetes, frequent trips to the hospital for all different things. And then eventually, once your weight gets high enough, it's joint pain and different difficulties with joints, which result in different types of surgeries, total knee replacements, total hip replacements, and the costs just keep going on astronomically.
Yeah, a lot of problems. Who qualifies for weight loss surgery?
Well, essentially, that's a good question. The Food and Drug Administration has just come out and lowered their criteria because of the amount of people who really need to lose weight. We use what's called the body mass index at this time. Body mass index is essentially a fancy way to say your height divided by your weight. As in the past, everybody would say, well, you know, some people are big bone, small bone. There's no such thing as those kinds of deals. You know, essentially the big bones went away with the dinosaurs.
Right, so that's not happening.
So a body mass index, when you look at that, most patients with a body mass index of about 30 now qualify for weight loss surgery. So if you go onto our website or the Banner Australia website, you can look and there's a body mass index calculator that you can just put in your height and your weight and it'll give you body mass.
You can find your BMI. Now, one of the most popular weight loss procedures is the lap band procedure. Can you tell me more about that?
Sure. A lap band is a procedure where we put a band, which is a silastic band, with a small balloon around the inside of the band. And that is, we sew that into the upper portion of the stomach. We put it around the stomach and cover it with gastric tissue so it doesn't move.
Okay.
And then that's connected to tubing, and you can see the tubing sort of right here. And the tubing's connected to this small port. Now, the small port is placed on the left-hand side of the body, and then we access the port with a small needle, using ultrasound, a small little needle, and we fill this balloon in there. So what happens is when patients eat, it actually slows down the amount you can eat at one particular time.
So you get fuller faster.
So you feel full because the nerves in the upper portion of the stomach get stretched, and then you feel that sensation.
Yeah, and you can actually see the video right here of that. And you actually had the lap band procedure. Can you quickly tell us how you relate to your patients?
Yeah, I mean, it's when you come to see me, it's sort of a different thing. I've been through it. I was 340 pounds, and now I weigh 220 pounds, you know, and I'm still losing weight. I've had my band in for about 3 years, and so
That's got to make people feel comfortable because you know about it, you've been through it.
And, you know, I can relate to them on multiple different levels. You know, I have my comorbidities have pretty much gone down to zero. I had sleep apnea, I had high cholesterol, I had hypertension.
And that's gone?
Gone.
And really quick success stories. I know you have some of those.
Oh yeah, we have several. You know, we have a couple of patients in particular. Barry here.
Great.
He's done fantastic. You know, he's lost over 120 pounds, and he looks great. And
he does. And another one you have too.
Yes, she lost 110 pounds.
Wow.
And
Great.
She's done fantastic as well.
I wanted a permanent weight loss solution.
Lap-Band was safe and it was reversible.
Within a few months of having my surgery, I was off all of my medication completely.
I just enjoy life now.
I don't use a cane anymore. I can run and play with my grandchildren.
They gave me hope that I didn't see happening any other way.
Call Weight Loss Institute of Arizona to register for a free seminar. 855-PHX-THIN. Weight Loss Institute of Arizona, your Lap-Band experts.
Well, losing weight is tough, but when your scale feels out of control right about this time of year, most people don't know what to do. Right now we have Dr. Michael Orris, is a fellow of American Society of Metabolic and Bariatric Surgery, and he's here with much more important information. Good to see you, doctor.
Thank you for having
Happy
me.
New Year. All right, describe the Lap-Band procedure.
Well, the Lap-Band is it's a silicone-based band that's placed around the upper portion of the stomach. And this is placed laparoscopically, and it creates this small gastric pouch. So when the patient eats, the food will go down the esophagus, gather in this small pouch, and slowly trickle through the band like sand through an hourglass. Thus, this will make the patient feel full faster and longer, and in turn, lower their caloric intake.
Now, who is a great candidate for the Lap-Band procedure?
The Lap-Band's made for the obese patient that has struggled with weight throughout their life. They try conventional methods like diet, exercise, behavioral modification, and they just didn't succeed in that. Or they yo-yoed their weight loss, meaning they lost it and then they gained it back.
Right.
And the Lap-Band is just an extra tool for that patient to not only help them lose their weight, but keep it off.
I didn't feel healthy. I had no energy. You know, I was starting to have knee problems, back problems. I developed diabetes. The Lap-Band surgery for me really changed. It just changed my life. Within a few months of having my surgery, I was off all of my medication completely. Why did you wait so long? That's what I would say.
Call Weight Loss Institute of Arizona to register for a free seminar. 855-PHX-THIN. Weight Loss Institute of Arizona, your Lap-Band experts.
Well, Hollywood actors and actresses work so hard to get the body they want if they've been struggling to lose weight, but diet and exercise hasn't worked. Well, surgery may be an option. And Dr. Michael Orris is back with someone who's experienced Lap-Band surgery. Sue is going to tell us her success story. Welcome.
Hi.
You look beautiful, first of all.
Thank you. Thank you.
What made you decide to do the Lap-Band surgery?
Well, I had gone to my doctor, and my doctor told me I was borderline diabetic. It scared me. The last thing I wanted to do was to be a diabetic. So I have high blood pressure, I have high cholesterol, and I have bad knees, and I'm a realtor. And getting down to get a lockbox open was hard, and it was embarrassing to get back up with the weight. So I went home one night after she told me I was borderline diabetic, and I decided that I wanted to take care of my body. Now, I didn't want to put on more weight, and I didn't want to get any larger, so I decided to go ahead and call.
Well, we're looking at a picture of you right now. It doesn't even look like the same person. How overweight were you?
I was over 50 pounds.
My goodness, what a difference there.
Thank you.
How much weight have you lost so far?
I've lost about 53.
Good for you. In what amount of time?
17 months. 17 months.
Perfect. How has this whole experience really changed your life?
Well, I'm single and I started dating again.
Good for you.
And I'm more social. What's been good is I've been able to get out and exercise and to do some things that I wasn't able to do. I've got my life back.
You got your life back?
And what I would mainly want to say to people out there, if you're borderline, if you're 50 plus pounds, do it, because don't let your body get in bad shape. I mean, the longer you wait, the harder it is on your body.
During a minimally invasive surgical procedure, an adjustable silicone ring or band is surgically inserted and placed like a belt around the upper part of the stomach, creating a small pouch. The band is connected by thin tubing to an access port just below the skin. Through this port, your surgeon adjusts the fit of the lap band system by inflating or deflating the inner lining with saline solution to meet your individual needs.
I feel like I was out of control and I couldn't get a handle on it. So I wanted a permanent weight loss solution, and this is my tool. It worked. 95 pounds I've lost. I'm a very active person also, and I love to dance and swim in the pool in a bathing suit. I can do all of that again.
Call Weight Loss Institute of Arizona to register for a free seminar. 855-PHX-THIN. Weight Loss Institute of Arizona, your lap band experts.
Welcome back. You know, losing weight is tough, but when your scale feels out of control, most people don't know what to do. Now, registered dietitian Michael Murphy and Rebecca DeBarros are here more, and they have important information just for you. Thanks so much for coming on the show today. We appreciate it. Rebecca, let's start with weight loss surgery. A lot of people have questions about it. What is the lap band procedure?
The lap band is a silicone device that is placed around the upper portion of the stomach surgically, and then the port is put underneath the skin. The patient comes in after surgery for fills to increase the circumference, so it creates a pouch on the top of the stomach, and then it creates that feeling of fullness.
Okay, so you're going to get full a lot faster after using the lap band.
Exactly, and you don't have to eat as much because you feel that sense of fullness all day long. Unlike other diets that you're constantly hungry, so then you end up not doing the diet.
Binging later, too.
Right, exactly.
Now, we're seeing video of it now, of the procedure that you just explained. Who is a good candidate for this type of procedure?
Well, pretty much anybody who's trying to lose weight from 50, 60 pounds to 300 pounds. People can lose weight with this tool through diet and exercise and this tool.
Now, once they have the tool, how important is the follow-up after surgery? I know we're seeing the BMI chart here.
Well, it's very important to have follow-up after surgery and to come in and get your fills and to talk to the dietitian and to, continue to educate yourself on how to use this tool to lose weight.
Yeah, and like you said, it's so important to educate yourselves, especially about nutrition. Michael, let's talk about that and what patients really need to know about their nutrition and what to eat.
Sure. I have here a representation of a typical day for a lap band patient. The great thing about this band is that this is the amount of food a lap band patient will sit down and eat for dinner. Now, for us, this is just an appetizer. This is just getting you started, okay? A little bit of salmon, a little bit of broccoli, and they're leaving that table satisfied, the same as you and I would need double to triple this amount of food to feel satisfied. For lunch, a little salad with some chicken on top would be all they would need. Again, this doesn't look like a lot of food if you don't have a lap band, but they feel that sense of fullness.
And that's the main part.
That's the main
They
way
really
it works.
Do feel it.
Another good example, here's a sub from a well-known Subway place. You have yourself a 3-inch versus a foot long. And when I'm in line to buy this, most people are buying the foot long, and that's how much food they eat at one sitting. When you have this lap band, that's all you need is that small little 3-incher, and you're good to go. The bread itself might even, might fill you up, so you might even take some of the bread off that as well.
Wow.
So a typical day would include a little bit of salmon, maybe some yogurt for a snack, a sub and a salad, half a cup of cereal, versus your typical serving, which is going to be about 3 times that much.
So you're still eating, and that's important for people to know. I mean, you're having breakfast and lunch and dinner. What about support systems?
The support is great. As far as what we provide at Banner Estrella, we give these patients the tools they need once they have their band to make sure the weight comes off. We're not just going to give them their band and say, we'll see you later, have a good life. We're going to bring them back, make sure that they're getting the right nutrition, the right exercise. We provide them with exercise physiologists. Myself as the dietitian. The 2 surgeons will be seeing them at every appointment. So
that's great.
We're not going to just let them go. We're going to make sure that the weight comes off. And although the band does most of the work, we want to be there to support them with the support groups and all the things that they need.
Exactly. All right. Well, thank you both so much for explaining that. Murphy is back now with patient Roseanne Calocha. Did I say it right?
You did.
Oh, good.
You did.
All right, now Roseanne actually had lap-bound surgery, and she's here to share that success story. Thanks so much for coming on, both of you.
Thank you.
All right, everybody really wants to hear from someone who has gone through it. Let's start with why you decided to get lap-band surgery.
I had been trying diets for years. I mean, I'd done all the programs that you can, that advertise on television. That I've tried things that were good for you, things that weren't good for you, and finally just decided that my health was being compromised to a point where I developed diabetes and was on medication for that, and was having thyroid problems and was starting to get sore knees and ankles, and just decided, this is enough. I have to do something.
Okay, so you decided to have the surgery. How much weight did you lose, and what was that like?
I had my surgery 4 years ago. It'll be 4 years ago in April.
There's the before picture. What do you think when you see that?
It makes me very sad, actually. It's like a whole different. I don't even recognize that person anymore. It's pretty surprising, but it's. I've lost about 178 pounds from when I went into the Weight Loss Institute, and I've actually lost about 188 pounds from my all-time high.
That's amazing.
Yeah, it's
188 pounds. How's that changed your life?
Oh, I move around more. I have a lot more energy. I didn't used to exercise, obviously, but I walk a couple of miles every single day, and I'm a travel agent and a travel writer, so I travel a lot for business, and used to had to get the seatbelt extender every time I sat on a plane. You couldn't get comfortable in the airplane, and that's just not the case anymore.
Yeah, you probably have so much more energy, I'm sure, too.
Oh, absolutely right.
Yeah, to do the things that you love. Michael, when you hear that story, I mean, what do you think?
Well, Roseanne is a perfect representation of why we love our jobs, because we get to see someone like her every day in the office. And a lot of people just don't realize this is a great tool. They've been through all the diets. They've done shots. They've gone down to 500 calories a day. Roseanne doesn't need to do that. She can live her life and eat normally and have this band and be very successful like you see there.
All right,
I chose the lap band procedure because it was not as invasive as gastric bypass. The Weight Loss Institute staff is fantastic. Again, I can't say enough good things about them. And they care. Everybody cares. They want you to be a success. You're not just another patient. I love them.
Call Weight Loss Institute of Arizona to register for a free seminar. 855-PHX-THIN. Weight Loss Institute of Arizona, your lap band experts.
This is a story about weight loss, but really it's about changing your life for the better.
My weight affected my life in every way possible. It affected the way I was with my son. It affected everything I did, everything that I wanted to do, everything that I couldn't do. Now I can do everything. I can do everything that I wanted to do. I can go out and play baseball with my son. I can go out and jog without embarrassment. I can go out and shop for little clothes that I wasn't able to do before and just lead a much fuller life.
Before I lost weight, I was an insulin-dependent diabetic. I barely moved. I had no life. I had children that, I took care of my children, but I didn't play with them. I didn't, it was limited activity on the floor or, small little games. It wasn't, I couldn't jump on the trampoline with them, take them even for little walks. It was too hard. I feel fantastic. I play with my kids on the trampoline. I go skateboarding with them. I put them in the wagon and run around, and we go to the park, and life is good.
Being overweight was something that you had to push past. And that was something I was constantly pushing past. So not only was it physically draining, it was emotionally draining. I don't have to worry about it, and rides at the fair, at the carnivals. You were concerned about whether or not the safety belts are gonna fit you. It's things that you don't have to worry about anymore like that. It's amazing.
Finally, there is now a proven, exciting new weight loss system that is FDA approved for weight loss. It's called the lap band system. This is a minimally invasive procedure that has long-term results and is FDA approved for weight loss.
We want every single patient to succeed in their weight loss attempt, because once they come here, they've tried every diet out there and they failed. Or they've lost 60 pounds, they've gained it back, which of course is called yo-yo dieting. And they want a permanent weight loss solution.
I struggled with my weight for probably the last 20 years. My weight affected my health tremendously. My health is wonderful. My blood pressure has dropped well back into the normal range. My blood sugars are perfectly normal. I run 2-3 miles 3 to 4 times a week.
We've seen so many people succeed when they lose their weight. They stop their blood pressure pills. They don't have to take any more insulin. They're off their CPAP machines. Their back doesn't hurt. They're able to get pregnant. It's just a life-changing event for them.
Please call us today to see if you're a good candidate for this exciting new weight loss system.
One-third of all Americans are overweight. If you are one of the millions that have tried dieting only to regain the weight, you are not alone. In fact, 1/3 of all dieters gain more weight than before. Most people have tried many different types of diets, but nothing seems to work long-term. Studies have shown that this kind of yo-yo dieting does more harm than good.
I tried all sorts of diets unsuccessfully. I tried diet pills, tried counting calories, high-protein diets, many things, but always seemed to, I'd lose a few pounds and gain it right back.
I had been overweight for about 17 years after the birth of my first child. And on and off, I did all kinds of things, you name it. The carb counting, the pills, this diet, grapefruit diet, drink this shake diet, and, eat the laxative diet, you name it, I did it. If I thought it would work, I did it. And it never worked, or it did work, but as soon as you stopped doing it, boom, I was back, even bigger.
I had tried many diet plans, diet pills, diet drinks, powders, you name it. I had tried it and just had been completely unsuccessful at everything.
The reason I think these were unsuccessful was because of the fact that it wasn't a true lifestyle change. It was something that I couldn't live with on a long time basis. It wasn't a real answer for me on a long-term basis.
Many people have looked into gastric bypass surgery as a solution, but found it to be too invasive.
The complications that can arise from it, including people that can't stop losing weight, the malnutrition problems that you can have with the gastric bypass, and just the fact that people seem to lose for a few years and then start gaining back.
I looked into the gastric bypass. Matter of fact, I was scheduled to have gastric bypass in March of 2000, and I decided against it. I decided that the risks of the surgery were too great given my diabetic status, and I decided not to.
Finally, there is now a proven, exciting new weight loss system that is FDA approved for weight loss. This system is an alternative to the cycle of yo-yo dieting and gastric bypass surgery. It's called the Lap-Band system. The Lap-Band system can change people's lives.
The reason I finally decided on the Lap-Band more than anything else was I needed to lose the weight. I mean, that was the absolute thing. I wasn't going to be able to go on. I wasn't going to live a long time going on the way that I was. I had to do something, and I had to do something quick. And at the same time, I didn't want to take more risk in doing it than I needed to. The Lap-Band, with its low complications and everything else, seemed the best choice that I had to make.
I found out about the gastric Lap-Band. There was a few celebrities that had it done, and I wanted to know more about it. Was this available to everyday people? And once I realized, oh yeah,